Okay, hi everyone. Welcome to It's Worth a Shot. It's September 6th and happy Wednesday, everyone. Today we are going to be talking about mobile vaccine clinics and we are going to showcase a vaccine tracking dashboard. Let's go ahead and go to the next slide. We want to remind you guys that tomorrow, or sorry, not tomorrow, in a couple of days, it is Environmental Services Week. So make sure that you guys are ramped up and ready to celebrate your EVS teams. We also wanted to let you guys know that hot off the press, our survey readiness book for nursing homes was shared out yesterday. If you guys missed that, let us know. We have the link here on the slides for you guys as well. And then as a reminder, next week on September 12th, we will have two presentations. Jennifer LeBay is joining us again to go over the minimum data set. She wants to get us prepared and ready for our October 1st. And then we also have a recovery-friendly workplace, and that's presented by Mountain Pacific. So we hope you guys can all join us for those. Some great trainings. Let's go ahead and go to the next slide. So just a couple of housekeeping items. Make sure that you guys let us know if there's any topics you guys would like us to discuss. And as a reminder, we'll send out an evaluation at the end. There's a good opportunity for you guys to plug in those needs into you can put it in the chat or put it on that evaluation. So we appreciate your feedback. And then we have a quick polling question. So is your facility prepared for the MDS update starting October 1st? How are you guys doing with it? Let us know. Somewhat ready. Ready? I love it. These are some good responses. Somewhat ready or out. Couple we need help. Okay, if there's a few of you guys on the we need help, feel free to drop your name in the chat for me, or you can just put it directly to me, whatever you guys are comfortable with, or feel free to email me afterwards and we can make sure we get you guys some assistance. And then make sure you guys hop on next week and join us for that MDS training. So thank you guys. Go ahead and end the poll and go to the next slide, please. Okay, so just some updates. As you guys are probably well aware, the hospitalizations continue to trend upward. We're at an 18.8% increase for hospitalizations, 17.6% for deaths. There's a small uptick in the vaccinations. I think that we're all kind of waiting for some updated data or information on the vaccinations. So let's go ahead and go to the next slide. You can see several of our regions are showing that substantial increase in rate over Wyoming, Alaska, Hawaii, and then kind of central Montana there. We're seeing some substantial increase in that. So, all right. So let's go ahead and go to the next slide. And I'd like to welcome our presenter today. Kyle Austin is joining us from Farm 406. He's going to talk to us about mobile vaccine clinics. And then after that, we will have Liam join us. So thanks, Kyle.
Hey, good afternoon, everybody. This is Kyle Austin. I'm a Farm D. I own and operate Farm 406 here in Billings, Montana. Basically started off as a contract pharmacist, and the COVID pandemic led me into doing a bunch of mobile vaccines. So that's why we're here today, kind of talk about what we do and why we do it and how we can help you out. Next slide, please. All right, so a lot of the challenges out there that we saw during the pandemic is vaccine hesitancy. A lot of it came down to like how it was presented, how quick the COVID vaccine came out. Education seems to be lacking from all aspects, unless people come into the pharmacy and they have one-on-one, but a lot of education needs out there. Fear of needles, you get the people that are fear of needles, that's it. But then politics played a huge role in that, which we all saw that become political. In Montana, we have, a lot of diverse areas, as many of you guys do in your states, where it's rural. There's lack of vaccine availability, storage requirements for some of those vaccines, and trained personnel is kind of lacking. And so I saw that going into the pandemic and led to us creating a mobile vaccine clinic where we can travel around and just bring these services to the people. Some of the other challenges is the cost of the vaccines. So as you know, in your facilities, you got 100 residents or more, and you're trying to, cash flow the Prevnar 20s, which are about $250 a shot, or the new RSVs that are about $300 a shot. Flu shots, and then the COVID shots are going to about $130 a shot this year. So the costs get pretty expensive. Other hurdles are the insurance companies. So as you know, do you bill Part D? Do you bill Medicaid? Do you bill Medicare B? And that's always a big challenge to make sure you get appropriate reimbursement. State laws, we've ran into a lot of old laws in our state of Montana that need to go bye-bye. But our legislature, elected officials are pretty old school and they don't like change. And so that's something we got to continue to work on. Collaborative practice agreements are required in Montana. That's something that probably needs to go bye-bye. Age limits on who we can administer to. In Montana, we were allowed to go down to 3 years old on the EUA, but that expired. And so now we're back to 12 and up, unless we have a collaborative practice where we can do 7 and up. And there's some gray area about whether pharmacists can supervise nurses or not, but here at Farm 406, we go ahead and supervise nurses and allow them to participate in our vaccine clinics. Next slide, please. And so a little history about me, we'll just roll through this pretty quick. I already mentioned that I was a self-employed contractor. I have a farm up in northern Montana that I leased out so I can dedicate a little bit more of my time to the profession. In 2020, everyone asked, how did I, come up with the great idea of mass vaccinating people efficiently? And what I did is I went back and studied polio and how that rollout happened, how they got the vaccines done, and, pretty much just kind of duplicated that, and it worked very well during the pandemic here. Down at the very far or the bottom side of the slide here, the key to the vaccine clinics is just keep it simple. There's nothing complicated about it. You get your consent form signed, you evaluate the patient, you administer it, and you move on. We don't have to make it difficult. And then the fall of 2020, that's when I started my mobile vaccine clinics, were as a trial run with flu shots, just to see how it'd work out and get my reputation around the state before the COVID vaccine came out. Next slide, please. And so this is how I started out. I had my Jeep. I just went and bought a little trailer that I can put supplies in. I got a Dometic cooler that would keep temperature control. And I just went around, set up inside grocery stores like Reynolds Market, and provided vaccines and did that around the state. Next slide, please. And then from there, we upgraded to a bus. We just need a little more space, weather dependent. We can bring people on the bus and do the vaccines there. The picture on the left, we're set up outside the Bozeman Brewing Company in Bozeman, where we did our Get a Brew, Not the Flu. So you get a shot, you get a free beer. And we continue our Get a Brew, Not the Flu program still today, and we're rolling that out statewide. And we're still partnered with Reynolds, where we go to their grocery stores as well. Next slide, please. So the vaccine program rurally has grown. And so today we have a semi. And basically from the farm, I have a CDL and a semi anyway. So I bought this trailer, had it painted, and we just bring people inside out of the weather. They do their paperwork in the front of the trailer, they get their shot in the back of the trailer, and they exit. And we could usually move about 300 patients through this semi in about 4 hours for vaccines. Next slide, please. So I mentioned the Reynolds market, breweries get a brew, not the flu. People have fun with that. They get rewarded. They get to hang out with their friends and neighbors or bring their friends and neighbors with them to get vaccinated. We go into places like Ford dealerships, where Ford dealerships have given coupons before and been a partner with it. We go into long-term care facilities, assisted living facilities, and group homes where we travel around. We've worked with many health departments around the state. And then this year, we've actually partnered with Lyft, which is a independent living nonprofit here in Billings, where they have a grant, and we're going out to 18 counties in eastern Montana to assist with vaccine access. Next slide, please. So just to kind of reiterate how easy vaccine clinics are, they're not a lot of work. We've moved about 80,000 COVID shots the first year at my pharmacy, and I only have a staff of 7 to 10 people. When I go out on the mobile clinics, it's usually 2 or 3 of us, not a whole lot of staff, and we can still move people through pretty efficiently and safely. During the pandemic, I kind of reached out and I hired retired licensed nurses and pediatricians that came in and helped part-time to get through it. So you don't need to worry about hiring full-time staff when you're doing these. You can find someone that just needs a couple hours. And then the EUA opened up the door for us to train and certify our pharmacy technicians to also help in the pharmacy and do these vaccines. Next slide, please. And so what did we learn? I still do it today, and I did it during the pandemic, is we shouldn't just walk away from the pandemic like we didn't learn anything. We need to look at what we did, how we did it, learn from it. And so if this happens again, we can probably make it more efficient and more acceptable. So the CARES Act was great. It eliminated a lot of red tape. It sped up the delivery, kind of, put the stomper to a bunch of state laws. Don't recreate the wheel. So what we saw is we have a distribution system in place every day that we use for our medical and our pharmacy supplies. But our health departments and the FDA and CDC and everybody created this whole new distribution system, which caused a big mess in the whole realm of things. But yeah, let's just keep it simple, use our distribution system that's in place. We want to eliminate waste going forward. So during the pandemic, there was so much waste, whether it was COVID testing, masks, gloves, auxiliary supplies that were getting shipped out that we didn't need. All that stuff ended up in the garbage. Single dose syringes, instead of the multi-dose vials that were shipped out, everything should be unit dose syringed, just to help eliminate errors, create efficiency. Going forward this year, there will be vials offered, but there will also be unit dose syringes, except for Novavax is staying with a 5-dose vial to meet the demands of the entire world. And so everything's consistent on their part, but there will be some single dose syringes out there from Moderna and Pfizer. And then simplify the process. Obviously, MTRAX reporting and vaccine cards really slowed things up. They probably need to take MTRAX and make it all electronic, even for the patient. So we don't have to give them these paper cards anymore. They just have an app or web access. Next slide, please. So kind of to help you guys out going forward here, some new information. So the COVID vaccine starting this year will be an annual shot. It's going to be monovalent, so no more bivalents, and it doesn't matter on the manufacturer. So we'll have Novavax, Moderna, and Pfizer on the market as the manufacturers, but they're all manufactured very similar to where they meet the CDC requirements. So it's going to be like the flu shot. It doesn't matter what brand you get. You can just give a COVID shot to the patient and they'll be covered just as much. Novavax, I chose to be our preferred COVID vaccine this fall. It's non-mRNA, but it has a lower side effect profile. And when I go out to a lot of long-term care facilities with people being fragile, I would rather have something with less side effects. And so that'll be our preferred, and then we'll also have Moderna with us as a backup in case someone needs an mRNA vaccine. Keep in mind, no more series on the COVID vaccine. So one shot and you're done. It doesn't matter if you get a new admit that never had the first, second, third shot, it doesn't matter. Just give them the one and they're good for the entire year, just like the flu shot. The cost of a COVID vaccine right now, the list price is it's $130 a shot is what the list price is, but with the administration fees in there, it's about $150 a shot if a person wants to pay out of pocket. This is covered by Medicare Part D, but it's not covered by Medicare B. So kind of keep that in mind. If you guys have an admit that doesn't have a drug plan, you might want to make them get a drug plan. The new vaccine that's on the market this year is the RSV vaccine for adults. It's available for ages 60 and older. The cost of this vaccine is $275, $300, depending on who your supplier is. It's covered by the Medicare D plan only. So again, make sure they have a drug plan for that. Down at the bottom, I don't know if you guys could see that, it's kind of cut off on mine, but for flu shots, we use a cell-based flu shot. And I recommend this to a lot of facilities because there's flu shots out there that have the latex, the egg, they're made in an egg, they got preservatives in them. And we go with the cell-based preservative-free flu shot just to help prevent side effects and allergies. With the cell-based, you can just give it pretty much to everybody and you don't have any problems with those. Next slide, please. Okay, so a lot of questions I get is, can patients receive more than one non-live vaccine at a time? And the answer is yes. You can give as many non-live vaccines as you want at one time, but you want to take into each patient's considerations. You know, what's the patient's condition, access to vaccine in communities. So like if I go out to Circle, Montana, for instance, am I ever going to go back there again, or do patients only have that one opportunity to get vaccinated? And if they only have the one opportunity, it might be good to go ahead and push the envelope a little bit and give them 3 or 4. Side effect profile does increase with the more vaccines you give, but some people are willing to sleep it off the next day or take a little extra Tylenol. The timing of the vaccine for coverage is also important. So conversation I had this morning with a facility was, this September, my first 2 shots I'd probably recommend would be COVID and flu together, and then wait at least 2 weeks, and then we can follow up with doing Prevnar RSV, depending on what the importance is for the area and what's going on. But if you do give vaccines, go ahead and separate those out by 2 weeks if you're concerned. That allows the body to build antibodies and immunity and get that vaccine through the system before you hit it again with more vaccines. Next slide, please. All right, so here's my contact info, pharmacy phone number, there's email, farm406@outlook.com, or you can follow us at farm406.com. On my website, I do post our community events when I'm going around the state, so you can kind of see if I'm going to be in a community near you. If I am, feel free to reach out because I can usually find a couple hours to come out to your facility and help you do vaccines. Next slide, please. And that's it for me. Thank you, guys.
All right, thank you, Kyle. I do want to just mention quickly, thanks to Kyle, he helped us work on some multi-vaccine consent forms last year, and we are in the process of getting those updated, and hopefully we'll have them sent out here soon. What we'll do is we can send those out with the It's Worth a Shot slides, so you guys have those, and I'll show you where to access those. So now I would like to turn the time over to Liam. He is one of my colleagues at Mountain Pacific, and we're happy to have him present today. He's going to talk to us about the nursing home COVID-19 tracking dashboard.
Hello. So as Callie mentioned, I'm Liam Hedinger. I am a data scientist here at Mountain Pacific. And I'm going to present, I'll share my screen here. Hope you can see that. So I'm going to present a tool that we presented, and it's worth a shot previously, but it's been much more streamlined and then has also incorporated the influenza vaccine. So some of the stuff you may have seen before in a previous It's Worth a Shot, but it wasn't very usable tool. And so hopefully this updated version will be a little bit more usable. Oh shoot. So this tool can be found on the Mountain Pacific website. The link is on this PowerPoint, but it'll guide you to this page. So to access this tool, you just enter in your name, your email, and then your associated facility. Click I'm not a robot, and then send. Once that's all sent, you'll this download bar will pop up, and you're able to actually download the template. So we'll download the template. One of the things Sorry. The computer's working a little slow today. It's still working on pulling up that. There we go. So once you download and open it, you'll get this file here. We'll click Enable Editing. Then one of the things you'll notice is there's going to be the security risk thing. This is acknowledging that there's a macro within this file. So there is a form in this file to make it a little easier for data entry for you guys, but that does use a macro. And so typically computers don't like that. How you can get around that is by saving that just to your desktop or wherever you'd like to save it, and then reopening it, and it should allow you to enable that macro at that point. It might be a little pop-up that you have to click to enable the macro, or sometimes it works just automatically once you've saved it to your computer. If you do have any issues with that, Google's a great resource, and it's pretty easy to get those macros enabled. But once those are enabled, you will have none of that red bar there, and the form will be in the entire Excel dashboard will be usable. So how this dashboard works is you click Launch Form initially. You type in the week ending of the data that you want to track. So let's say we want to look at this week's data. So we'll type in 09/06/2023. Well, you can type in your facility CCN. And what typing your facility CCN will do is it'll link to the NHSN COVID information. And then that will all pull into the spreadsheet, which allows you to kind of track your own personal COVID information through this dashboard without having to enter it in another place weekly. So I'm just going to pick on one facility CCN. And then you'll type in the number of residents that you have. So let's say we had 100 residents, and then number of healthcare professionals that you have in your facility. This part will possibly be updated in the future if NHSN includes influenza vaccines within their public-facing resources, but currently they do not. So you'll have to input your influenza vaccines manually. So we have 100 residents, and let's say 90 of them were vaccinated with the flu vaccine. And then 15 of the healthcare personnel were had a flu vaccine. So we'll submit that. And then just so we can get some, the graphs will start populating, we can kind of see some of the trends, we'll enter next week's data as well. So 0/13, that's 2023. Do the same. CCN, 100 residents, 20, and now we're at 100%, unlike before. We'll submit that data and press yes. Once you've submitted your data for that week, you can go over to either the vaccine dashboard or the COVID case dashboard, and go to use the data tab and press this refresh all. This in the bottom here, we'll say running background query. It can kind of take a second. But now that that background query is ran, we can see our different information about our facility as it pertains to COVID and influenza data. So here we have the percentage of current residents and healthcare professionals that have completed a vaccine at any time. So that's going to be your primary series vaccine. Here it gives you information on bivalent vaccine information. And then this bottom column here will give you information on your influenza vaccines within your facility. The blue line is typically going to be the healthcare professionals, and there's a little legend here on the side, and the other line will be residents. On this other side here gives information so you can kind of compare your facility to how the nation's doing. So this graph shows the percentage of the United States population who have received a completed COVID-19 vaccine. It has a 65 and older population as well as an all-age population. This gives you information on the bivalent vaccine broken down in the same way, 65 and over population, and then I guess it's 5 and over population, not all ages. And then this bottom one gives you weekly information on influenza data. Currently, that hasn't started tracking yet because we're not quite in influenza season yet, but that should be coming soon. The prediction is early in October or late September. We'll start getting that information. This will start populating. We also have a COVID cases dashboard. So this information comes from NHSN and can show you your COVID confirmed cases, your weekly admissions to the hospital, and then your COVID deaths. So hopefully this will be an all-encompassing resource that you can use to really track how your influenza vaccines are doing, how your COVID vaccines are doing, as well as those COVID cases, and can be a valuable tool for using in your facility. So I'll hand it back to Callie, leave 3 minutes for some questions or anything like that.
All right. Thank you, Liam. And thank you again, Kyle. Do you guys have any questions for them? I saw there was a few in the chat. There were some questions regarding whether Tylenol or aspirin can be administered post-vaccine. Kyle recommended giving Tylenol. It will not affect the immune response. And Kyla added, the CDC does specifically say not to take pain relievers prior to vaccine, but it's okay to give Tylenol after. And then I see Maria, you have your hand raised. Do you want to go ahead and unmute and ask your question?
Yeah, I just had a question about the tracker that was just shown. That's just like for personal use? Like if you want to use it for your own facility?
Yes, that was the intent of this. So you guys can showcase this if you wanted to. You can even put it on some of the nursing homes I've been in have a monitor. So if this is information that you want to showcase within your facility, you could print it, you could have it showcased on there. So you guys can show how well you're doing with COVID cases, deaths, hospitalizations, all of that information can be quickly accessed.
So it's just I'm sorry, in my mind, it's like it's one more place to put in the information we're already putting in NHSN and our various reports or whatever. But the advantage is that you guys are providing like the other metrics and like the comparisons and the national data for the same time period. Is that the benefit?
Yes, that would be one benefit. The other one was just to try to make it easier for your infection preventionist to share this information during like quality assurance meetings.
Okay.
These would be good visuals for the facilities to show and to share.
Okay, thank you.
Uh-huh. Okay, we are at the top of the hour. we went ahead and put the chat or the link in the chat for the evaluation. So if you wouldn't mind, please fill that out. And we will see you guys next week for It's Worth a Shot on Wednesday. So have a great day, everyone. Thank you.